It's going pretty good. I'm relying pretty heavily on the central campaign, and Brian Mason and everyone in central office has been doing a pretty good job. Actually keeping the debate civil and trying to add some experience to the leaders' debate and to the campaign that's been going on. He's been doing a good job focusing on the issues and representing Alberta's views. Well, the strategy has been, like I said, relying on the central campaign, relying on the strength of our platform, using some social media and doing as much media as I can, as well as going to these all-candidate debates. Unfortunately, it's a bit of a low-resource campaign, but it is a building campaign, and I think there is a lot of potential in this constituency, and we're looking to the future.
The NDP is the party who will tell you, yes, you want what you want, and that is a good thing, and this is how we will pay for it. The other parties might say it's a great thing, but they will never have the money to pay for it. With healthcare, we would keep the cap on long-term care beds at $25 a day. Premier Redford, in her election campaign, said that she would like to look at taking off that cap so that she could bring more private sector involvement into long-term care. We need 1,500 more long-term care beds. That would cost us $300 million. There's about 1,500 seniors waiting on waiting lists. They're taking up our ERs and they're taking up our acute care beds. That's costing us more money than if we would just build the long-term care beds that they need. But yet this Conservative government's waiting for the private sector to do it. Well, it's not going to happen. They're going to build beds that are too expensive. We would have minimum staffing ratios so that the seniors get the care they deserve. We would invest $100 million into home care, which would help 100,000 Albertans stay in their homes longer and be healthier so that they don't need to access the system. We'd invest $50 million in mental health care beds so that we can have, well, quite frankly, you keep those people off the streets.
We released some documents outlining how the second phase of an Alberta Health Act would come about. When we presented those documents in the legislature, the minister at the time, Mr. Zwazdecki, said that those were not the government's plans, that was simply what Albertans were talking about. And quite frankly, I haven't heard any Albertans talking about that, except for PCs and in back rooms. And you hear bits and pieces, and this was the first documentation we had of that discussion. And now, you look back, after Klein won his election, he introduced the third way. After Ed Stelmach got his election, they introduced Ron Lightman and his amalgamation and his bed closures and whatnot. And after this election, I'm pretty sure we're also introducing some elements of privatization.
I spent some time in university and I spent some time working with administrators. And one thing that was clear to me was that foreign students pay more in tuition. So why wouldn't we want to fill our universities with them if you're an administrator? So what we're talking about is funding for education. Doctors' cost to become a doctor raises every year, and that's because we don't cap tuition. And actually, the NDP plan is to not only cap tuition, but to decrease it by 10% in 2012. And that is basically the whole idea. We make education more accessible, so you don't only have kids with rich parents going into medicine, and we will have more doctors and nurses. Moreover, I have a sister-in-law who became a nurse because in 2007-8, they were screaming for nurses. They were hiring them from overseas. Then, in 2008, the economy crashes because we are living paycheck to paycheck with this government. We don't save enough money, and we don't collect enough in royalty revenues and taxes. So we laid off a bunch of nurses, and then a whole cohort, I talked to them, a whole cohort of nurses went to another province, and other provinces to get hired. Now, we got a boom again, we're going to need to hire a bunch of doctors and nurses. How much is that going to cost? It's ridiculous.